Well, hi everyone. Thank you for being here with me. And I'm glad to be part of this year's Shape West Virginia Spring Virtual Conference. My name is Adam Baus. I'm the co-director of research for the West Virginia Alliance for Creative Health Solutions and the director of the Office of Health Services Research in the School of Public Health at WVU. I'm very pleased and privileged to be here with you all. And over the next half an hour or so, I have the opportunity to tell you about an incredibly important initiative for our state's public health and the health of our children. It's called West Virginia's Clear Future, which delivers the Catch My Breath anti-vaping curriculum to middle schools. For the past 2.5 years, our state has been working very deliberately and carefully and effectively to deliver this curriculum and to help improve the trajectory of the health of our state's youth. So I'll share my slides, but I do want to express just how grateful I am to be part of this. And there's room for you. If you've not heard of this before, if you'd like to get involved, even if you've thought about getting involved but haven't yet, there is room for you. So again, glad to be here. I'll share my screen. We'll step through some slides together, and there'll be contact information at the end for not just myself, but some of the primary deliverers of this curriculum, and that's what's incredibly important. So we'll get started, and again, thank you for having me. Okay, let's uh, let's start at the beginning. Okay, so like I mentioned, my name is Adam Baus. I've been privileged to work in public health in West Virginia for about 23 years now, and getting the opportunity to be part of the West Virginia's Clear Future team and to help evaluate the Catch My Breath program has really been a privilege. Um, uh, Dan Doyle, who's a physician here in West Virginia, and Christina Mickey. They are leaders at the Appalachian Pulmonary Health Project. Dan and Christina are some of our primary go-tos to learn more about this initiative, as is Chast Barkley with the American Lung Association. So again, at the end of this uh, presentation and recording, you'll have contact information for those partners, incredibly strong individuals who can tell you a lot more about their work, where they're working in the state, and how you can get plugged in. So, okay, we'll get started. But the information that I have to share are some of the evaluation highlights from West Virginia's Clear Future over the past 2 years and how we're doing in our third year and where we're going moving forward. Okay. So, West Virginia's Clear Future is made possible through the leadership and support of a lot of dedicated organizations and individuals. First, we've got the West Virginia Department of Health. The Department of Health is a longstanding pillar for our state to uh, address primary public health concerns. And tobacco prevention, vaping prevention is definitely up there. So incredible leadership from our state and support from a variety of funders. And we're very grateful for that. We've got the Claude Worthington Benedum Foundation, Logan Healthcare Foundation, the Palatine Foundation of Buchanan, as well as the Palatine Foundation of Huntington, the Sisters Health Foundation in Wheeling, Greater Kanawha Valley Foundation, American Lung Association of West Virginia, and then the Appalachian Pulmonary Health Project, those last two being some of the implementation arms of this initiative. Okay, so a little bit more about West Virginia's Clear Future. Um, it's the West Virginia's Clear Future Don't Let Vaping Cloud It initiative, which is a great name for a great project. This is a 3-year effort, and it started in 2023, so we're in our third year currently. And it's focused on providing the Catch My Breath vaping prevention curriculum to every county in West Virginia. It's a big endeavor in 3 years, but we've made amazing progress. And it's targeted to middle schools specifically. That doesn't mean high school students haven't taken part, and they have, and I'll share some of those data with you as well. But our focus has been on middle schools. And the goal is clear and simple, to educate students early and prevent them from vaping and using e-cigarettes. And we know from the research that if we do this, we also help to prevent nicotine use going forward. So intervene early, support their health, and knowledge base intentions, decisions early, and it has amazing payoffs for the future. Okay, so this is a slide representing a lot of dedication and work and initiative over the past 2.5 or so years. So West Virginia's Clear Future started in the fall of 2023. And you can see here back in September, August, September of 2023, that's where we started. And this chart represents progress over time in delivering the curriculum and reaching students. Now, what I wanted to point out is that in this chart, this is a modest conservative chart. We're only looking at grades 5 through 8, right? So from the fall of 2023 to present, we have these data are current as of just about a week ago. We have 17,736 course deliveries or students that have been taking part and engaged in West Virginia's Clear Future, the Catch My Breath curriculum. That's just grades 5 through 8. If we span that out to grades 5 through 12, which I'll step away from my slides for a second. We've got time for that. I'll step away. We'll look at our online dashboard. But if we look at the totality of what's been happening, we're nearly at 21,000 students just here in West Virginia. That's a lot of reach, a lot of time spent talking about important prevention knowledge among our state's youth, among our students. Um, but this is an amazing graph to me. So the green line represents the pre-tests. Okay. So these are the questions that we ask before the curriculum is delivered. And then the yellow or the gold line represents the post tests, which are the questions that are asked after, right? So it's an important piece of information for us that the gap between the pre and the post is not very big. So we want to get the reflections and the post-survey data from as many students as possible so that we can tell as clearly as possible what the impact is. So I'm glad to see that gap remaining pretty reasonable, pretty narrow over time. It's very important. So let me step out of this presentation for just one moment and go to our live dashboard, which is right here. Let me refresh it. Okay. So again, we were looking at grades 5 through 8 only, right? So let's expand that to look at 5 through 12, just as an indication of how we're doing. So to do that, I simply select the additional years, and there it is, our chart updated for us. So there's that 20,896. And again, these data are current as of the early February 2026. We update these data bi-weekly, and I'm very glad to say that we use them. We use these every week, every meeting, honestly, to monitor our reach, our progress, troubleshoot, do any course corrections, and also to compensate the schools for the time and the energy that they're putting into this initiative. So we can see when they start to deliver, who they're reaching. We can see the evaluations from the teachers coming in and the feedback that they have for us. And we can use that incredibly valuable feedback to keep improving our approach and our delivery over time, which is amazing, incredibly important. And before I move away from our live dashboard, I wanted to take a look at some of the demographics from this year's pre-survey data, just as an example of the kinds of data that we look at regularly to see how we're doing. Okay, so in this case, we're only looking at the current school year. So from August of 2025 to now, we can change that, and we will in a second. But that's the date that this particular view is looking at. Again, grades 5 through 8 only. And we can see in this school year, uh, proportion wise, we have the bulk of our participants in West Virginia's Clear Future uh, in seventh grade and in eighth grade, about roughly 30% each. And you can see that right here, 30.7% seventh grade, 29.8% eighth grade, and then followed by sixth and fifth, right? We have a very even split between male and female students, around 48% in both cases. And now you can see down here a representation of the counties that are taking part. So we have, for this current school year, the bulk of our participants are coming from Berkeley County, followed by Cabell, Kanawha, Webster, Mercer, Randolph, Jefferson, so on and so forth. That's represented in the bar chart as well as in the map, right? If we hover over our map, we see more detailed information on the specific schools taking part in each county. And from an implementation standpoint and from an evaluation standpoint, that's really important for us to be able to have a lot of granularity, clarity on the data, and to be able to monitor what's happening over time. So just for fun, let's take this survey date and change it for a second. And that just gives you a sense of how we use the data uh, meeting to meeting, period to period. So let's back this up to the start of West Virginia's Clear Future. There we go. So now you can see every county that we've reached so far, the proportion of students that are in represented in each of those counties. And you can also see that the distribution it stays pretty solid, right? So we still have a lot of seventh and eighth graders, sixth and fifth, very even split male to female students. And then you can see, of course, like where in the state we are and which schools in particular have taken part and how many students in each school have taken part, right? And going a little bit further, let's expand this out through grade 12. And then I'll get back to the slides, I promise. But let's make this 9, 10, 11, and 12 as well. All right, and now you can see um, here's our ninth, 10th, 11th, and 12th graders, which are, there's some there. The focus of our initiative has been on grades 5 through 8, but there's been opportunity to deliver the curriculum to high school kids as well. It's very important. And I think what you'll see in the data is that our students are saying that they would recommend West Virginia's Clear Future to all middle and high school students. And that's found in our student reflections data. We'll take a quick look at that. So these data, again, are from just this current school year for just grades 5 through 8. We can change that anytime we want. We can look back in time more. We can expand uh, the grades out further into high school. But these are just our middle school kids and what they're saying about this initiative. And then I'll get back to the slides, I promise. But we have 80% agreeing to strongly agreeing that they feel confident that they can refuse a vape if offered because of a skill that they're learning from this curriculum. We have about 85% saying that they agree to strongly agree that they're less likely to vape now that they've taken part in Catch. Um, we have about 88% almost 89% saying that they've learned a lot about e-cigarettes because of the program. Here we go. This is the one that I was thinking of. We have nearly 90% saying that they think all middle and high school kids should go through Catch My Breath. That's a lot of positive feedback from a lot of students. And we have about 86% saying that they understand advertising better because of Catch. So, with all of that said, I'll pop out of this dashboard. I'll go back to the slides. But the data that we use week to week is incredibly important, not just from an operations standpoint, but just from a continuous quality improvement standpoint. We want to know where we're going, who we're reaching, how we're doing, what the feedback is, and we have opportunity in real time to adjust. So those weekly, bi-weekly meetings we have are incredibly important for that. Okay, thanks for the tangent. All right. So this is a look at these trained teacher availability across our state, or in other words, our workforce of teachers who have been trained and are available and able to deliver this curriculum. This is a huge success. It's hard for me to stress enough what a big win this is for us, that in every county in our state, there is at least one, if not many more, trained teachers. So hats off to the implementation team at the American Lung Association and the Appalachian Pulmonary Health Project for all of the effort that this took. This was a big effort. So we have 10 counties in our state that have one teacher, and that's represented with the lighter yellow shading, right? So the lighter the shading, the fewer the teachers. And then we have 25 counties that are up in the 2 to 5 range. So we're getting a little more in terms of the capacity. We have 8 counties that have 6 to 10. And we have 5 counties that have 11 to 20, right? Represented by the darker green shading, such as like Mercer, Raleigh, Cabell, Berkeley. And then there are 7 counties that have greater than 20 trained teachers. And you'll see that represented in areas like Kanawha, Raleigh, Putnam, and so forth. Those are huge wins for our state. And again, we're so thankful for the teachers and the schools that have taken part. And as we go through the slides, you'll see that there's more opportunity for you and your students to get involved if that's something that you want. And we welcome that always. Okay, so some highlights from our year 2 evaluation. So each year we do a very careful in-depth evaluation on terms of how we're doing. We did that for year 1, we did it for year 2, we'll do it for year 3 once that wraps up. But as of the end of year 2, which was back in that would have been towards the summer of 2025. At the end of year 2, there were 9,138 students in just grades 5 through 8. And you can see in the charts that we just looked at, those numbers are now much higher already, right? But that was the end of year 2. Uh, in 2 years, Catch My Breath reached 72 middle schools. I think that's impressive. And that those 72 middle schools represent 31 of our state's 55 counties. And again, I talked about that gap between the pre and the post tests. We have an 82.5% overall pre-post test completion rate. That's really solid for survey research, especially in schools. Super busy, a lot going on, but again, super thankful for all of the dedication and effort that goes into delivering this program. So attitude and knowledge are incredibly important always, right? So we've had um, big gains, increases, wins in these areas. So again, this is just our year two evaluation results. One of the big points here is that there's a correct identification now that water is not a main component of e-liquid in the vapes. And that knowledge increased substantially from what was 36.1% at pre up to 65.5% at post. That represents, I mean, school is all about learning, right? Good knowledge, good choices. This represents a lot of learning across a lot of students. Incredibly happy to see that. There's recognition, much improved recognition that nicotine is addictive and harmful. Even this smaller percent increase from 90.4 to 94.8, that's substantial. That still represents a lot of kids who are now realizing that nicotine is not for them. It is harmful, right? And also in terms of knowledge and attitude, we have a much improved awareness that well, people under 18, you're really 21, aren't allowed to use cigarettes. This under 18 represents an older um, criteria before we stuck with the survey wording that came from the Catch national group. So that's why under 18 is represented there. But still, that improved substantially from about 70% up to 81.7. Um, and for each of these, those were statistically significant, which is represented by this p-value. So all of these findings really matter practically and significantly for our students. Okay, behavioral intentions. 82.1% of students agreed to strongly agree that they can refuse a vape if offered because of a skill that they offer that they learned in the program, right? And these are our year two evaluation results. We have nearly 88% agreeing to strongly agreeing that they learned a lot about e-cigarettes, and about 85.5% agreeing or strongly agreeing that they're less likely to vape because of this curriculum. And for us, these findings indicate a strong alignment between the content of what the students are learning and the intended behavioral impact, right? So what we're teaching is the results of it are what we want to see in these classrooms. All right, susceptibility to use. Okay, so overall susceptibility was unchanged generally. Susceptibility is, if you haven't vaped, are you heading in that direction? So we didn't see a lot of change there, but um, that's not to say that this is challenging or bad in any way. Um, Sixth, seventh, and eighth grade students exhibited no significant change, with rates remaining stable from pre to post intervention. That's good. We do see some interesting findings with fifth graders that we're learning more about, but fifth grade showed a slight increase in susceptibility to vaping. So that's an important finding for us, and it lets us know that that may be a grade or a time period where some additional coaching, training, intervention, curriculum might be useful for fifth graders in particular. Okay, teacher feedback. For every classroom has opportunity to deliver feedback, and they do, and we appreciate that. So here's what we're seeing in terms of what's working well for Catch is student engagement. That's come up a lot in the feedback that we're receiving. Students are engaged, they're taking part, they're learning, they're interacting, and that's good for a classroom setting, right? We're seeing good feedback in terms of helping with media literacy and health literacy in the students. We're seeing good feedback from teachers in terms of them feeling that their students are learning refusal skills and increasing their capacity to say no. if offered a vape. Um, we're getting good feedback in terms of the lessons being creative and interactive, and also great feedback from teachers in terms of misconceptions around nicotine and vaping and the harm of these things, that those are being corrected over time. That's very encouraging to hear. And that the curriculum is well structured. We're getting mentions of that too. Um, Suggestions for improvement, always important. We're hearing some feedback on technology being an issue at times, accessing the materials. We always want to make sure that these are as easy as possible to get a hold of and use. Time is also always a factor, and some of our instructors have let us know that they have limited time to do this work. And we understand, we try to make it as efficient as possible. And that the content repetition, that's not necessarily a bad thing, but it can be at times. But there are instances in the curriculum where you have the same content reinforced, and sometimes it's noticeable in good ways and maybe not so good ways. But content repetition was a suggestion for improvement. Okay. Takeaway messages from our year two evaluation. So um, in 2024, 2025, implementation of Catch showed continued effectiveness in increasing students' knowledge about e-cigarettes, influencing behavioral intentions, and helping to maintain overall susceptibility levels with some variation by grade, right? But those levels were at least maintained. This program reached new milestones in educator training, with at least one trained teacher now present in each of our state's 55 counties. That's a big win. Um, these outcomes affirm the program's value and provide us with actionable feedback to guide future improvements. As we keep going, we want to make this better and better. And that finally, a strong takeaway message for us is that maintaining high engagement and supporting educators, supporting our teachers, and tailoring efforts to the schools and the local context of what's happening is really essential to sustaining this initiative and expanding it, helping that positive impact reach more and more schools and students. So, some very good news for us. We've just had a manuscript accepted into the Journal of Primary Care and Community Health. That acceptance was in February of 2026. I anticipate this article will be out in print this spring, and wherever you are, whoever you are, I'd like to make sure that you can have a copy of this. So I won't share data from the manuscript because that's to come, but these are some 6 takeaway messages from that manuscript. First is that Catch My Breath is working in classrooms, and that's no small feat. Across the state, we're seeing that it's feasible and possible to deliver this program in a variety of school settings across the state. Um, that's really important that the program is can be available, accessible, and integrated really in no matter where we go. That's huge for us. Um, Second main point, teachers are central to all of this success. And it's the educators who were the key drivers of implementing this program, and the teacher feedback that we receive has really helped to shape the program improvements and the tools and the supports that we have available to offer. So, um, sincere thanks to all of the teachers out there that are working on this. The students are responding positively. That's a big win for us too. The students are demonstrating a stronger understanding of vaping, the risks of vaping, and having increased protective intentions on not vaping after taking part in Catch. Okay. And over these past 2.5 years or so, we have a really solid workforce around the state where this curriculum can be delivered in all of our state's counties. And there's always more progress to make. So if you're interested in this, if you want to take part, we're all yours. And we want to meet you, talk with you, and help make that happen. Um, Another thing that helps make all of this possible is that we always want to improve what we're doing. And that continuous quality improvement process is built in to what we're doing. So that online dashboard, all those data that we review regularly, that's formative evaluation that helps us identify where we're working, what's how it's going, be it good or challenging, and what we can do to improve and strengthen over time. So that continuous quality improvement process is very important for making all of this happen. And lastly, I think this is will hopefully resonate with everyone is that prevention matters. And the earlier we can intervene, the better. Prevention matters early. So middle school is a critical time point, critical window for building knowledge base, learning new skills like health literacy and media literacy, and building up refusal skills that as these um, challenges are encountered, that our students are ready and able to avoid trying vaping, to avoid e-cigarettes, and to say no to these things, and to have a lot of confidence and self-efficacy that they can do these things. And that those good decisions early will help long-term health outcomes over time. Okay. This is an additional look at vaping trends. So these data represent whether or not in the past 30 days, a middle school student in grades 5 through 8 has vaped. So what we're doing here, we're looking at our data over time for West Virginia's Clear Future, as well as um, other historic data that we had before West Virginia's Clear Future. So Catch My Breath has been being delivered in West Virginia since back in 2020, 2021. So really a long-term investment. So um, the blue bars that you'll see on here represent the number of pre-tests or students reached, and the orange line represents the vaping past 30-day vaping. So for example, back in 2020 and 2021, we had 1,281 pre-tests during that year. And we had a 7.65% past 30-day vaping rate, right? So that vaping rate dropped in 2021 and 2022 down to 5.95%. And that was out of about 3,500 students grades 5 through 8. That trend dropped again in 2022, 2023, down to 4.15%. That was out of about 4,800 students. We increased a little bit in 2023, 2024. So out of 5,200 students, that vaping rate was about at 5% or 4.98. And we plateaued last year in 2024, 2025 at 5.2%. And this current year, very happy to report that, the school year is not over, and the data will be more current and complete once the school year wraps up. But out of 3,830 students, we're at a 3.9 or about 4% rate. So this dotted line is our trend line over time. And you can see from where we started back in 2020 to 2021 to where we are now, this current school year, we have a very strong trend downward. So um, that's very reinforcing, reassuring that what we're doing, it matters, and that we're helping to make a difference in something that really matters for the health of our state's children. So I was happy to send that data your way. And the overall change, this is an important point. I didn't want to forget that. The overall change from school year 2020, 2021 to the current school year, 2025 to 26, it's a negative 3.66% drop, and that's a 48% relative decline in past 30-day vaping. I just want to pause there for a second. 48% relative decline in vaping. So that represents a lot of children who are in a much better trajectory health-wise for the long haul. So that's very exciting to see. I think that we'll be keeping up that good trend over time. And again, very grateful for all the people and resources that it takes to do this, but the work matters, and I'm very excited to help show that. Um, we have an earlier publication on West Virginia's Clear Future uh, and Catch My Breath. So those data are from 2019 to 2023, and the trends that we're seeing here align with that prior research that we're seeing as well. So we're definitely heading in the right direction, and we're seeing that in a variety of analyses that we do over time. So that's great to see. All signs are pointing in a positive direction. Okay. So a sincere thank you to all of the teachers and the educators that make this work possible. And I can't stress enough that your work in the classroom contributes to measurable statewide progress. So thank you for everything that you're doing for our kids. It matters. And please join us. We'd love to work with you. So let's work together to give every student the skills, the confidence, and the knowledge that they need to better navigate peer pressure and to protect their health, right? So we have a few contacts here for you. Any one of these individuals would do an amazing job at talking with you more about Catch and how you can get involved. Christina Mickey, Dan Doyle, and Chas Barkley, they're some of our major drivers of making this work possible around the state. So I would encourage you to reach out to one or all of them about talking with them about what's going on, where it's happening, how you can get involved. All of this is free for you. We want to make sure that these resources, this program, the expertise, the people that care about doing this, that you can reach out to them anytime and talk with them. So there's their emails. And again, I just want to say that this initiative is led by Department of Health in partnership with ALA and the Appalachian Pulmonary Health Project. So you can get more information about Catch My Breath out on the Catch National website. And also, again, I do want to stress that Christina, Dan, and Chast can tell you a lot about this initiative, much more than me. And they would be happy to talk with you, as would I, if you have any questions about the data. Right. So if you do have questions about anything that I presented, or if you want to talk about the evaluation or how we're doing what we're doing, or learn more about any of the bits and pieces of data that I've shared, I would be glad to speak with you. Again, I'm co-director of research of the West Virginia Alliance for Creative Health Solutions and director of the Office of Health Services Research and School of Public Health at WVU. So I'm all yours. If you have questions or want to talk, feel free to reach out to me anytime, and I would be glad to talk with you. So thank you for a wonderful session together. Thank you for your time, your energy, and your dedication to the state's public health and to our students and kids. So, all right, take care. Thank you so much.